So you can see the PowerPoint slide. Can you see it? Okay, okay. So today we'll discuss about the pathology of hemopoietic and the immune system after the last cardiovascular system. So under this hemopoietic and the immune system, there are some developmental anomalies. So one of the most important anomaly on this hemopoietic and the immune system, so far your examination is also concerned. In most of the examination, sometimes in Viva also, like you may be asked, or in theory paper also, you may come across one question may be associated with, just a minute, some are waiting, why they are late. So that is what I have mentioned means one of the most important developmental anomaly. Okay, that is known as autoimmune hemolytic anemia, and it mostly occurs in case of falls. That's why I'm giving in the name of autoimmune hemolytic anemia in falls. Just a minute again. Some are waiting. Why they are late? So I will give you the this example also as in case of this human also means it is very common in human as you might have heard about the ladies having Rh negative. Okay, means Rh factor you might have heard means when the ladies women having this Rh negative we used to give stillbirth babies and all these things, right? And those things which is related to this autoimmune hemolytic anemia. So first, I will just give you this brief idea about this autoimmune hemolytic anemia in case of falls. So when we are talking about this case, autoimmune hemolytic anemia. So in case of these horses, when the stallion, the male partner, is having a this blood group, okay, which is different from the mother, the mare, means there are incompatible blood group antigens of the stallion and the your mare, means these male and female parents are having incompatible blood group antigens, different blood group antigens, okay. And when they cross the product, the baby, that means the foal, so which is there inside the womb of the mother, the mare. So after the exposure of the blood circulation through placental exchanges inside the womb, means which used to get the womb, the fetus used to get blood circulation through the mother through placental blood exchanges, right? And the baby means the foal is carrying one kind of this blood group antigen which is different from the mother, okay. As means you can see the this picture also like this, okay. The womb which is the inside the womb, the foal fetus which is having one group blood antigens, okay. But when the mother is not having the same group blood group antigens, so in this case when there is blood exchange, so there will be production of antibody against this blood group antigen. That means the blood group which is carrying by the fetus from the father, that will go to the circulation of the mother. That means in the mere circulation. So there, because of the unknown, which is incompatible to its own blood group, that means the mare. So there will be production of antibody. Okay, and this antibody will be circulated in the, I mean this blood circulation of this mother, and that will go on accumulating in the colostrum. Okay, and it can pass through these antibodies which has been accumulated in the colostrum, which can pass through the epithelial, I mean this epithelial, sorry, I mean in two different things. Means let me disclare you this here. In case of these animals, mostly the epitheliochorial placenta, the wall, I mean this, is having 6 layers and above. Whereas in case of this human, it used to have less than that. So in case of human, it can pass through this epitheliochorial placenta. So it will get into the, I mean this fetus, and it will go into the circulation of the fetus, and there they will lyse the RBCs, means destruction of the RBCs, because these antibodies mostly they are of hemolysin type, and these hemolysins after getting into the circulation of the fetus, what I am talking about is in case of human, and that will cause lysis. Just a minute, some are waiting or what?
Yes, sir.
Please come in time, otherwise it disturbs a lot the classes. So that is as in case of this humans, means it used to cause lysis of the RBCs inside the womb of the fetus. Whereas in case of these animals, these antibodies which is formed in the circulation of the mother, that cannot pass through the epitheliochorial placenta, so it will go on accumulating in the colostrum. And when the young foal, I mean the baby is born, so they will suck the milk from the mother, I mean this colostrum. So through the colostrum, the foals used to get the antibodies along with this colostrum that contains the hemolysins mostly. And these hemolysins, means those antibodies containing these hemolysins, will get absorbed in the intestines of the fetus, and that will lead to destruction of the RBCs of the foals, leading to very severe type of this hemolytic anemia. And ultimately, because of the excessive lysis of these RBCs, so after the lysis, I don't know, means you might have learned in details about the jaundice. Okay, icterus. So after the lysis of the jaundice, sorry, I mean these RBCs. So depletion, I mean of the RBCs into, I mean this bilirubin and the heme portion and this iron portion and all. I think you might have learned it. So that bilirubin level will be very high and it will be accumulated in the tissues, mostly where the visible mucous membrane and skin used to be having this high level of this, I mean due to the high level of this bilirubin in the blood circulation, and this visible mucous membrane skin of that affected animal will be yellowish in color, means it is the indication of jaundice or icterus. And when it is to excess, okay, even because of this hemolytic, this anemia leading to icterus, jaundice and all, even the foal may die after some time. So that happens as in case of this autoimmune hemolytic anemia in case of foals. At least if they don't die also, this foal which is born alive, even they will remain very much anemic, very much stunted growth, and means sometimes means it may die also, like if it is too much excessive destruction of the RBCs used to be there. That used to be there in case of animal, particularly in case of this foal. Whereas in case of this human, means as I have already given the example, that the father and the mother, means the parents are having incompatible blood group antigens. I'm just giving the example of Rh factor. You might have heard about Rh factor, right? The father is Rh positive, whereas the mother is Rh negative, means the mother is not having this factor. Negative means it is not having, it is not there. In that case, the fetus which is receiving Rh positive from the father, whereas the mother is not having this Rh factor, right? And the mother is carrying this baby, this fetus inside her womb. And during the blood circulation exchange, placental blood exchange between this mother blood circulation and the fetus, so fetus which is carrying Rh positive, that will go to the circulation of the mother, whereas the mother is having, not having Rh factor, means Rh negative, and the Rh positive which is going into the circulation of the mother. So this way, the mother will have, what to say, this get the, this Rh positive from this baby, and there will be production of antibodies against this Rh positive, Rh factor inside the blood circulation of the mother. And what happens is that for the production of these antibodies, let me show you the next slide, then I will describe properly here. Okay. And what happens is that this kind of this Rh positive, this coming from the baby which received from the father, of course, and that Rh positive will go to the circulation of the mother in the first pregnancy. Okay, so this production of these antibodies, it takes time. So that's why the baby may be born alive and nothing problem may happen in the first pregnancy, in the first issue. But there will be production of a lot of these antibodies against this Rh factor in the circulation of the mother in between the pregnancies, in the subsequent, means in the next, it is already developed. The mother is carrying these antibodies already. And second time, when the lady, this woman, the mother this conceives again, and the same way, the baby will carry the Rh positive. Whereas in case of the blood circulation of the mother, which is having Rh negative, Rh antibodies, okay, anti-Rh antibodies, so that will be in the circulation of the mother, and this will pass through the placental barrier, okay, and it will go into the fetus, and it will cause excessive lysis of the RBCs of the baby, the fetus, and that excessive lysis of the baby, the fetus, because of that excessive lysis and all, so that will lead to destruction of the RBCs and the severe, this anemia, and as well as even, if it doesn't cause death, sometimes if it is too much excess, then even the fetus used to die inside the womb of the mother, okay, or if it is born alive, also that will be very much anemic, and even the brain may be damaged when this, this anti-Rh factor, this antibodies which is getting through the mother's blood circulation, going into the circulation of the fetus, leading to excessive lysis of the RBCs, and that cause a disease commonly known as hemolytic disease of newborn. Okay, this fetus may die inside the womb, or if it is born, then means it will be having very much severe anemic condition, or even the brain may be damaged. Okay, that I don't know, means you might have heard about when you learn about the jaundice and all these things, erythroblastosis fetalis, or this kynecteris, you might have heard, I think. That means when this kind of this this Rh factor, one kind of this hemolytin, this factor, that will cause excessive lysis of the this RBCs of the, I mean, your embryo, or I mean this fetus, that may lead to excessive anemia, or even it may die. Okay, or it will get absorbed, it will go to the brain, and the severe damage of the brain may happen. That is known as kinecteres. Okay, this way means the baby may be born dead, or it may be born alive, even means mostly means of course that, I mean this stillbirth used to be there in the subsequent pregnancies, not in the first pregnancy. Okay, in the subsequent second, third, fourth, like that, I mean, because during the first means it will get these antibodies from the, I mean this fetus, it will go to the circulation of the mother, and the baby is born without having any this effect. But during the pregnancies in subsequent, there will be production of huge amount of this anti-Rh factors inside the circulation of the mother. It will be there inside the water. Means once it is, I mean, first pregnancy and the delivery already occur. Okay, and it will remain in the circulation. So in the second, third, fourth, like in the subsequent pregnancies, whenever means it conceives, the mother conceives, so there will be mostly means it will cause erythroplastosis fetalis, or means and the baby is born dead, or means if not, I mean very severe, I mean this hemolysis leading to erythroplastosis fetalis, or and this very severe and this anemic condition, even cardiac tears and all, so it will not survive much longer. So this happens in case of this human, because these antibodies, this kind of these antibodies which is from, I mean that is anti-Rh factor antibodies, okay, which is from inside the mother's circulation or inside the mother, I mean that will cross through the placental barrier or placental epithelioplacental barrier. But in case of animals, because of the thick, very thick, because more than thick 6 layers it used to be in this animal, it cannot pass through that, so it cannot kill the fetus, but it will be accumulating inside the colostrum. And when the baby used to suck newborn animal, I mean mostly fall, I was giving the example, so they will suck the blood, and the colostrum which contains that antibody, and that will cause severe hemolytic anemia and icterus ultimately. But in case of this human, it used to be having, I mean this even direct death, I mean of the fetus, or if not that, severe hemolytic anemia leading to icterus or even cardiac tears, I mean brain damage and all, and it will not survive longer. Okay, that is about this, I mean autoimmune hemolytic this anemia. One is in case of animals, most commonly means in case of this falls. Then in human, when the woman or the this mother is having Rh negative, while the father is Rh positive. So that happens in case. But nowadays, of course, there are some just medicines for controlling and just for the treatment of these things. I mean, before pregnancy and the subsequent pregnancy means mother used to be given this, I mean, this injection and all this in that type of this drug injection, then it can be prevented. And I will show you that on this drug later on. Then next is anomaly, congenital defects in case of lymphocytes. As you know, the lymphocytic cells are known as immune cells. Okay, this type of this stem cell aplasia or agenesis means it used to be in case of this RN falls when there is defects in the lymphocytic cells, and it commonly means usually used to be combined. There may be combined immunodeficiency with the absence of this both T or B lymphocytes. There are two types of these lymphocytes, T lymphocytes and B lymphocytes. And these are having some congenital defects, means they are not formed, they are not fully developed, for example. So that's why combined immunodeficiency will be there in case of those animals. And it may be inherited due to some gene defect from mother to the offspring, it may be inherited. And there will be differentiation and maturation defects, I mean, in the lymphocytes, which used to be mainly characterized by agammaglobulinemia, sometimes lymphopenia, hypoplasia of the thymus, lymph nodes, and the spleen. Okay, these are the main and lymphoid organs, the thymus, lymph nodes, and spleen and all. So there will be hyperplasia, hyperplastic condition of these organs, and the reduction number of this lymphocyte lymphopenia, right? Then next is Sézary-Higashi syndrome. So in this anomaly, there has to be defective forms or defects in the phagocytic cells, mostly the neutrophils and the monocytes. And because of these defects, there will be defects in the chemostasis, this chemical attraction, this engulfment and killing of the bacteria, as we have already discussed in the chapter of this inflammation. Okay, how this phagocytic cells used to engulf the this microorganisms. Okay, the organism, this infectious organisms and all these things. So there we have learned about chemostasis, engulfment, and killing of this bacteria and all these organisms, right? So because of the this defective form of this phagocytic cells, which used to perform this chemostasis, engulfment, and this killing of the bacteria and all these things, that will not be there. That will be defective. That will not be performed properly. So this disease condition or syndrome, where these phagocytic cells are defective in nature, it will be usually associated with defective assembly of the cytoplasms, cytoplasmic microtubules, which are responsible for degranulation and release of the lysosomal enzymes. Okay, that's why there will be depression of the superoxide anions, which leads to persistent bacterial infections. That means when those animals having this syndrome, that is Sézary-Higashi syndrome, where the neutrophils and monocytes, that means those phagocytic cells are defect in nature, means they are defective form. So they cannot protect from this infection, persistent bacterial infections. They are immunodeficient because their phagocytic cells are defect. So that's why they will be easily disinfected by any this bacterial infection. Means they will be very much prone to any kind of persistent bacterial infection. There is no any immunity this against those, because they are already having phagocytic defective phagocytic cells, right? So that is about this Sézary-Higashi syndrome. So these are some of the these pictures. You can go through it later. How it used to happen, this kind of this defective phagocytic cells, and how they affect the this in the chemostasis, then engulfment and the killing of the bacteria and all these things. Right. I will provide you the this PDF format. Then next is, now we are coming about the anemia. In this chapter, means this is another important this part that so far your examination is also concerned. Again, sometimes some long type question, means what is defined anemia or what is anemia, and what are the different causes or the factors leading to this anemia, on description of some type of this anemia, right? So anemia means nothing, means it is defined or is nothing but the decrease in the number of RBCs or erythrocytes, or the hemoglobin concentration inside erythrocytes per unit of blood. You are connected, for example, 1 ml of blood. Okay, if you go for counting the RBCs, the total number of the RBCs is too much less. Decrease in the number is there. Along with that, the hemoglobin concentration is also less. There is reduction in these cells, RBCs. So this condition is known as anemia. But most commonly, whenever we are talking about this, anemia, even if you go to this medicals, these medical doctors for examination or for some treatment and all this, and first they used to see whether you are anemic or not. That means by observing the mucous membrane, particularly the conjunctiva, of course, they used to see whether you are anemic or not. If you are anemic, means you are having less number of these RBCs as well as hemoglobin concentration in your RBCs are there, then your visible mucous membrane will be pale in color. So this paleness is the indication. Along with that, there will be dyspnea, difficulty in just breathing, cardiac hypertrophy, as well as weakness, means you will be very weak. Okay, so these are the characteristic features, means when someone, I mean some animal is having anemia or is very much anemic, that means they will have pale mucous membranes, they will be, I mean having dyspnea, difficulty in breathing, and the heart will be hypertrophy, I mean cardiac hypertrophy, and they will be very much weak. Okay, then now coming to classification of this anemia, it can be classified according to the morphological characteristic of the erythrocytes, means how the erythrocyte structures, morphological structures are there. There are some variation. Okay, so basing on the morphological structure of the RBC erythrocytes. Then number two is basing on the causative factors. So first one, morphological classification. I mean classification of this anemia on the basis of the morphological structure of the RBCs. So it can be classified as macrocytic anemia, normocytic anemia, microcytic anemia, depending on the size of the RBCs. That means macro means larger, normo means normal size, micro means smaller. So the size of the RBCs may be variable in different cases, in different anemic cases. Okay, then according to the, I mean this hemoglobin concentration, quantity of the hemoglobin, the color of the RBCs used to be different. Okay, that is, there may be normochromic, means normal color of the RBC. Then hypochromic means the hemoglobin concentration is less. Then hyperchromic, another it is missing here, means increase excessive quantity of the hemoglobin concentration is more. So this way, there are different type of this anemia basing on the morphological as well as the quantity or the this concentration of the hemoglobin is like this. Okay, so now let me show you some, I mean just pictures of the, I mean this anemia. Means mostly if you try to see the, the visible mucous membrane, they are very much pale in color. But one here, I mean in two pictures, one is here, another is here. If you see that the skin and the visual mucous membrane, mostly the this conjunctiva, right in the eye, it is yellowish in net, I mean the color. So this is another this condition. Of course, this is also one kind of this anemia where there is to be lysis of the RBCs leading to a hemolytic anemia, leading to jaundice. Okay, that is also associated with one kind of this anemia, what we call hemolytic anemia. Okay, after the lysis of the RBC, as I have already described that, I mean this mentioned that, I mean this depletion or separation of the iron portion, heme and the bilirubin globin. Then from the globin, bilirubin used to be separated, and the bilirubin used to be this retained, I mean in the blood circulation or the tissues and all, and it will give yellowish in discoloration when there is very much high, I mean this concentration, and that is the indication of the, and this disease what we call jaundice, right? Then these are the those types of the this anemia basing on the morphological as well as the concentration of the hemoglobin. So first one, macrocytic hypochromic anemia, means the size of the RBCs will be more increased, but there will be less coloration of the hemoglobin, hypochromic. Okay, so this kind of these things mainly happen due to acute blood loss, or as in case of this hemolysis, and excessive production and this availability of immature hypochromic erythrocytes used to be there, right? As I'm showing this picture here. Then next is macrocytic normochromic anemia. The size is increased, but there is normal concentration of the hemoglobin, and mostly it used to be caused as in case of deficiency of folic acid, niacin, and vitamin B complex 12, vitamin B12, right? And next type is normocytic anemia. This the size of the cells, I mean these RBCs are normal, but the number is decreased. So anemia is there, but it is normocytic. Okay, the size of RBCs are normal, and That used to be happen as in case of this cancer and this neoplasia, or as in case of this irradiation like X-rays and all. And this is also known as aplastic anemia as a result of aplasia and agenesis of RBCs. That means in such cases, sometimes the production and development of the RBCs used to be fail. Okay, aplasia or agenesis means there is no production nor there is no development of RBCs. So in that case also means there may be such kind of this thing. This aplastic this anemia, right? Then normocytic normochromic anemia. The size of the RBCs are normal as well as the concentration of the hemoglobin is also normal, but there is reduction in the number of RBCs. So it may be due to depression of the erythrogenesis, means during the developmental process of the RBCs is this depressed or there is some defection or defective form. Then last one is microcytic hypochromic anemia. That is, micro means decrease, reduction in the size of the RBCs, and hypochromic, the color of the RBC due to the hemoglobin concentration, it used to be that red color, right? But it is hypo, means the reduction in the color, decrease hemoglobin concentration or this percentage. Okay, and in that case, such kind of these conditions, microcytic hypochromic anemia. So that used to be caused as in case of your just a minute. Deficiency of this iron, pyridoxine, or as in case of this chronic blood loss. So in such cases, you may come across microcytic hypochromic anemia, right? Then now there are some, these terminologies associated with this anemia where you may come across different type of this, these RBCs, and there are some this definition or these terminologies which are important so far, your definition, or sometimes in fill in the blanks, or some objective type questions and all, right? Just a minute. Nasir. Just a minute. Class next pore phone korbo. Class next. So first one is anisocytosis. That means size of the RBCs are variable. Means different size. Some are large, some are small, some are medium. That way means there may be variation in the sizes of the RBCs. That condition is known as anisocytosis. Then next is poikilocytosis. Poikilocytosis, where there is abnormal in the shapes, abnormality in the shapes of the RBCs. When there are many these RBCs having different shapes, there are there may be some are elongated, some are angular, some are ovoid in shape, some may be distorted type. So that condition is known as poikilocytosis. Then nucleated RBCs, means nucleus, the RBCs is having nucleus in the cells. Okay, except in the immature type of these RBCs, and in case of avian species, the RBCs used to contain nucleus. Otherwise, you will not be able to see the nucleus in the RBCs, red erythrocytes, right? So one is during the immature, when they are not mature, it will contain. Then another is in avian species. All the RBCs are nucleated. Okay, so this is known as nucleated RBCs. And when there is number of these nucleated RBCs in some, this animal, when you are examining the RBCs, this blood examination and all, that means there is increased production of, some immature, these RBCs which are nucleated in this form, that is produced to meet the excessive demand of blood when the excessive loss of blood is there, and the body used to try to compensate the this increased demand of the blood. So during that period, some immature RBCs can be formed. So if you see those RBCs, after this examination, on examination and all, you will find many of those RBCs are nucleated. That means those are immature, newly formed, and they are immature, right? Then next is basophilic stippling. This is nothing but those RBCs which are having some minute dark spots inside the RBC structure. I will see you. I'll show you the just pictures and later on. Okay, in the next slide. Then next is polychromatophilia. That means those RBCs which stand unevenly with some dark, some part of the RBCs which are dark in color, while some parts are having light color spots. In two different spots maybe different, and the one is dark, another is light color. Okay, so this type of these RBCs after staining and all giving two different colors in the inside the RBCs. So that is known as polychromatophilia. Then hinge bodies. There are some, this granular type of this structure, this some purple in color, purplish granular structures inside the RBCs, most commonly near the cytoplasmic membrane. Okay, these are nothing but the due to the denaturation and the precipitation of hemoglobin. So there used to be formation of these purplish granular structures inside the RBC just nearby the cytoplasmic membrane. Those are commonly known as hinge bodies. So let me show you these pictures of these different RBCs. Okay, these are about the anisocytosis, different sizes. Some are large, some are small, some are medium. Then poikilocytosis. Okay, different shapes. Some are annular, some are elongated, some are distorted, like different shapes. Okay, then here too, you will find anisocytosis, poikilocytosis, macrocytosis, also hyperchromic, and all this. Okay, then so far your this chromatophilia, having two different type of these spots, some dark spots, some light spots in the cytoplasm of the this RBCs. Then another is basophilic stippling. Okay, basophilic stippling, dark spots are there in the RBCs. Then hinge bodies, some granular structures. Okay, these are the due to denaturation and precipitation of the hemoglobin, mostly in the cytoplasmic membrane, nearby the cytoplasmic membrane. Okay, so this kind of this, uneven stands. This. Some are dark and this thing. So hinge bodies used to be there, right? Granular this structure. Sorry, purplish in color. Okay, like this. Another picture here. This hinge bodies. Okay, like this. Then another. This is about the this polychromatophilia, means different uneven stands. Some are some portion are dark in color. Some portion are light in color. Right. Then now other these types is according to the etiological and or this causative these factors, the classification of this anemia. The earlier one was basing on the morphological structure of the RBCs as well as the concentration of hemoglobin, right? So now under this classification, first one is about hemolytic anemia. Hemolysis or hemolytic means lysis of the RBC, severe destruction of the RBC will used to be there. Because of that, there will be reduction in the number of these RBCs. And mostly after lysis of these RBCs, as we have already discussed about icterus, that means jaundice. So that is one of the most common indication that the animal will have icterus. That means jaundice, yellowish discoloration of the visible mucous membrane or the skin. That is the first indication, characteristic feature. Then along with that, hemoglobin urea will be there. Means your bilirubin, this urinobilinogen will be coming through the blood circulation. Then going out along with the urine. Okay, that is the percentage of this hemoglobin will be more. I'm just coming out through the urine, what we call hemoglobin urea, and the presence of these nucleosides in the blood, as well as hemosiderosis in the spleen, means hemosiderin pigments. So after the depletion of the RBCs, because there is excessive lysis of the RBCs, one side is bilirubin, this part, this globin on the protein part depletion, leading to jaundice as well as hemoglobin urea. Then other part, that is the iron part, so that used to remain accumulated inside the lymphoid organ like this spleen most particularly. So that is known as hemosiderosis in spleen, right? So mostly it used to be caused by many infectious conditions like anaplasma, then babesia infections, then equine infectious anemia virus, as in case of these toxicities, poisoning cases like by snake venom, chronic lead poisonings, or as in case of these immune mechanisms, as we have already discussed about autoimmune hemolytic anemia. That is another example or cause, right? And so far the growth changes are concerned, as we have already described or discussed also, there will be pale mucous membrane and yellowish discoloration leading to jaundice or this icterus. The blood will be very much thin and watery, and there will be presence of this hemoglobin in the urea, what we call hemoglobin urea, right? Then microscopically, there will be very much reduction in the number of these erythrocytes. There may be presence of this nucleated or immature RBCs in the blood, examination when you are examining, as well as hemosiderin pigments will be there in the cells, of the spleen. Okay, so here one on this test known as Combs test, maybe of two types, direct comb test and indirect comb test. So this test is one kind of this technique to examine this immunohemolytic anemia. Okay, by using some antigen, color antigen and all this thing, this Combs reagent. So by seeing this agglutination or not, there is agglutination or without agglutination and all, we have to check the hemolytic anemia in the these animals as well as this in humans. So that is known as Combs test, maybe of direct Combs test or indirect Combs test, two different way, right? Then next type of this anemia is about hemorrhagic anemia. You know this hemorrhage, what is hemorrhage? That means extravasation. After the breakage of the vessel walls, RBCs used to be coming out. Blood cells, mostly the RBCs used to be coming out of the vessel. That is what we call hemorrhage. Okay. So due to the severe hemorrhage, when there is severe hemorrhage, is the breakage of the this vessel walls. Okay. And extravasation of the blood means coming out of the blood from those vessels. Any part of the body. Okay, so that what we call this hemorrhage. Because of that, you are losing blood. Means along with that blood, mostly RBCs. Other blood also. These blood cells also. But RBCs, excessive number of the RBCs are lost. So that kind of this anemia is due, means that is due to hemorrhage. Okay, and this kind of this hemorrhage here also you will have the the animals or the humans, any this individual having this type of this anemia due to hemorrhage, losing this many RBCs and all these things. So that will be showing pale mucous membrane as well as many hemorrhagic lesions, maybe different kind of this hemorrhages, pinpoint hemorrhage means PTK or chymotic, or even this larger size this hemorrhagic lesions. Okay, so maybe in the different body parts. That means because of that hemorrhage, you are having the problem of this anemia, means due to excessive loss of these RBCs, right? So it may be as in case of this many infectious conditions, infections like acute septicemic diseases, as in case of this these toxicities, then poisoning cases, like most commonly, one of the most common fact, this is bracken fern poisoning in the Himalayan regions. Fern, you might have seen this fern, those these plants, right? And ferns, some particular bracken fern, one type of this fern, after the consumption of that contains some toxic material. Okay, and that may cause severe hemorrhages in the your urinary bladder. Okay, and excessive blood loss used to be there in those animals, particularly when they are having this bracken fern. This because of that poisoning of this bracken fern, right? So that may lead to this kind of this hemorrhagic anemia. And in case of this parasitic this infestations, one of the best example is Haemonchus, this contorters or blood sucking parasites. Means those parasites after going into the this body, different body parts, maybe in the intestinal tract or any parts of the body, sucking and this blood and all, leading to hemorrhages and all these things. So because of the excessive loss of this blood to hemorrhages, then it will lead to hemorrhagic anemia. Okay, or as in case of this deficiency cases due to vitamin C deficiency, that also here you may have come across such type of this hemorrhagic anemia. And gross lesions are mostly, they will be pinpoint, or that means PTK or this chymotic hemorrhagic lesions, and all the visible mucous membrane will be pale in color. And here there will be presence of this whole blood in the urine, not hemoglobinuria. It is known as hematuria. Hematuria indicates the whole blood, not the fragmented or lytic. That means in this case there is no any lysis of the RBCs. So that's why intake RBCs will be present in the urine. Okay, means intake RBCs will be coming out of the urine along with the urine. Whereas in case of this hemolytic, hemoglobinuria after the lysis of the RBC. Okay, but here the whole blood means the intake RBC will be there. Okay, so hemoglobinuria and hematuria, these two things are different. One is containing hemoglobin, another is intake RBCs, all blood. Okay, and automatically means microscopic lesions will show. They are also in the sections. Many parts of the tissues and organs will show hemorrhagic lesions. There may be macrocytic or normocytic characteristics, these features, structures of the RBCs. Sometimes there may be poikilocytosis, means different shapes of the RBCs, and there may be hyperplasia of the bone marrow. Okay, then next type is deficiency anemia, which occurs most commonly due to the deficiency of the iron, copper, cobalt, as well as vitamins. And in such cases, means deficiency of minerals and your this vitamins, leading to this anemia. When the animal or the this human this having too much deficiency of these minerals, mostly iron, copper, cobalt, and many of the vitamins. Okay, so here again, of course, the most common thing in any case of this anemia is pale mucous membrane, except as in case of hemolytic. In case of this hemolytic, mostly they used to show what kind? Pale mucous membrane also may be there, as well as yellowish discoloration or mucous membrane due to jaundice, right? And the animal will be very weak and debilitated body condition will be there, and decreased number of these RBCs with hypochromasia, means reduction in the this concentration of the hemoglobin, giving less color of the RBCs when you check the this blood, right? And as we have already mentioned, means most common factors or causes are deficiency of iron, copper, cobalt, and among the vitamins, vitamin B12, pyridoxine, riboflavin, and folic acid, and as well as in case of these parasitic infestations, many of the parasites due to suckling blood and all. So along with the blood, this they may this loss, this kind of this vitamin and this and even your this hemoglobin concentration, and so they may have this type of this deficiency and this anemia. Okay, and gross changes are like similarly this paleness of the mucous membrane. The water this blood will be watery in nature with light red color because the concentration of the hemoglobin is less. That means hypochromasia. Okay, and the animal will be very weak and debilitated, and even the carcass when it died of this severe deficiency of this of the deficiency anemia. So the carcass will look very much weak and debilitated, very much emaciated type. Okay, and heavy parasitic loss may be there. Excessive number of parasites may remain present inside the GI tract. Okay, then microscopically there will be microcytic hypochromic erythrocytes, means small size as well as less hemoglobin concentrated this RBCs. or sometimes there may be poikilocytosis, different shapes of RBCs, right? So these are some of the, these pictures showing, different, this anemic conditions, and that is aplastic anemia, iron deficiency anemia, pernicious dysanemia. Okay, this type of this deficiency anemia, and this sometimes in the name of this pernicious anemia due to this deficiency of these vitamins and minerals and all this, right? Then next type is toxic aplastic anemia, means due to toxin, some toxic factor, or sometimes and means drug, maybe drug poison, this toxicity, or like some this virus, this infection also may be associated. There are some particular this virus infection used to be there, like feline panleukopenia virus, one virus used to be there, or as in case of this radiations, like many these radiations like X-rays, gamma rays, UV rays, and all these factors. So what they used to lead is that, means there used to be agenesis or aplasia of the hemopoietic tissues in the bone marrow. That means from the bone marrow, the RBCs, these are the stem cells. The RBCs used to be formed. Okay, but this kind of this development or production of these RBCs from this hemopoietic tissue, that means in the this bone marrow, so that will not be there, and there may be lack of erythrocyte production, means automatically means there is very less production or no production, sometimes even it may be, mostly of course less production. And this condition is mostly characterized by absence of developmental stages of erythrocytes. Okay, that means normoblasts, megaloblasts, and all. So it will be there. These are the these different developmental stages of erythrocytes. Okay, so this may not be present. Less production of RBCs means it, or it is not at all product. Produced, or sometimes. Okay, agenesis, aplasia. That means no production, no developmental process of these RBCs from these hemopoietic tissues. That means the bone marrow, right? Then, if you see those animals having this problem, there will be very much paleness in the mucous membrane. The animal will be very much weak and debilitated condition it will be, and they will be having difficulty in breathing, dyspnea. That means then bone marrow becomes very much yellowish and fatty in nature. Okay, and when you examine the this blood and all, so there will be absence of the developmental stages of this RBCs, what we call normoblasts and megaloblasts and all these things, or there will be agranulocytosis. This agranulocytosis means reduction of the WBC in the circulating blood. Okay, and bone marrow becomes very much fatty. This is about your toxic aplastic anemia due to toxicity, or sometimes due to radiation, or some virus, particularly one very particular feline panleukopenia virus. In case of this feline species, it used to be there. It used to subside the production of this RBC, right? Then next is what we have already discussed, autoimmune hemolytic anemia. Nothing more to discuss. Of course, already we have discussed, means due to the this destruction of the RBCs by the immune mechanisms, as we have already discussed. When the parents are having different this incompatible blood group antigens, that means autoimmune hemolytic anemia, means as in case of this fall, and in this anemia in humans also, I have given the example of Rh factors. And sometimes, in such cases, what happens is that antibody production used to be there against the own RBCs of an animal, as we have already discussed. Or some infectious conditions, disease conditions like equine infectious anemia, anaplasmosis, and systemic lupus erythematosus. Okay, in erythematosus, in such cases also you may come across this kind of this autoimmune hemolytic anemia. And in such conditions, this type of this anemias will show here again similarly paleness of the mucous membrane. Sometimes, of course, not only paleness, yellowish discoloration also may be there, according to, if jaundice is there. Then enlargement of the liver, spleen, and the lymph nodes are very common because of the lysis of the RBCs, depletion of the RBCs into this heme portion, iron portion, and the globulin, and this protein portion, globulin. Then separation of the bilirubin from that. Okay, hemoglobin and this. So it will be going out along with the urea. This urine. Sorry. So that is what we call hemoglobin urea, means hemoglobin percentage, and this concentration will be more in the this urine, and there will be lameness of the affected animal due to rheumatoid arthritis. This autoimmune hemolytic anemia is associated one of the very this common condition, as in case of those animals, newborn animals and all. There, this rheumatoid arthritis used to be there in the joints. Okay, you will learn in details about this rheumatoid arthritis in the, I mean, this musculoskeletal system, means when in the joints. Okay, I mean, this some kind of this arthritis used to be there, or not arthritis, means osteoarthritis, some rheumatoid arthritis that I mean, just give you in details later. So because of that arthritis, joint inflammation, I mean, the animal will go lame, means they will not be able to even move properly. Then microscopically, there will be erythrophagocytosis, then demonstration of, I mean, presence of this erythrocytes in the Okay, if not, I mean, if it is there also, I mean, if when you check the dead fetus, so the dead fetus may show, I mean, this very much severe hemorrhagic lesions on the skin, and jaundice color, this also may be there, and even the brain may be totally damaged, carnivorous, that may also be there, or if it is born alive also. Okay, and I mean, it may not survive for long. I mean, in that condition also, you may come across such type of these lesions. What I'm talking about is hemolytic disease of the newborn due to this kind of this autoimmune hemolytic anemia. When the parents, the father and the mother are having, I mean, this different blood group antigens, most commonly about this Rh factor. The father is Rh positive while the mother is Rh negative. Okay, so that happens in case of these humans. Okay, and this is the one, I mean, what I was talking about. Okay, now as we have already discussed about the hemolytic disease of the newborn, about this autoimmune hemolytic anemia in case of this humans. So this carnic teres, as I was talking about, when increased level of this bilirubin in the blood, which goes to the brain, and brain damage, the total damage of the brain may be there. Okay, so that is what we call carnic teres. Okay, and this kind of this disease, hemolytic disease of the newborn, or erythroblastosis fetalis, which commonly occurs in case of this human when the father is Rh positive and the mother is negative. Okay, Rh negative. And now such kind of these disease conditions, okay, can be prevented by the administration. I was talking about some drug that is anti-Rh D-gamma globulin, commonly known as Rogam. Okay, to the Rh negative mothers just after pregnancy. Once it conceived and pregnant, at the time, if it is given such kind of this drug, then it can be prevented now. But earlier, I mean, so many cases, I mean, it happened mostly in those, I mean, without any this precaution, preventive measures and all these things. So RS negative. And this ladies, and I mean, women used to give this stillbirth from the second pregnancy onwards, right? Then next is, what is the time? Uh, few minutes can I take? Miss, let me complete this. I mean, only few are left. Or what? Shall we stop? Hello? Few slides are left. So shall we continue or shall we stop here?
Let's
Anybody?
stop here, sir.
Okay, okay. Then let me continue in the next class. Few slides are left. Oh, okay. I was trying